Welcome back. There's lots of things people do to protect their physical health. We can wash our hands, get vaccinated to fight the spread of the flu or COVID, and we might focus on eating right or working out to prevent cardiovascular issues and diabetes.
But you can add pay attention to your mental health to that list of things that can affect your physical health too. Medical experts say stress is affecting people 2 years into the pandemic, and it can be detrimental to your body.
Today, Dr. Renee Bullock-Palmer, a cardiologist at Deborah Heart and Lung, is joining us with more information on that. Welcome, doctor.
Good morning, Amanda and Kelsey. Thank you for the invitation.
Yes, thanks for being here. Doctor, first, let's talk about what is creating this stress. Also, can you name some of the stressors you see most often?
Certainly. So I think in this time of uncertainty, people are just highly wound, stressed. There's unexpected school closures, even for some people returning to the office. For others trying to take care of sick ones, having to do isolation for COVID-related reasons. So all of these things have led to stress, and this can have detrimental impacts on your body. The increased cortisol level, which is a hormone in the body, adrenaline, and norepinephrine. This can really cause dramatic impacts on the body, with the heart, and even lead to unhealthy habits.
You touched on it a little there, the physical health problems that stress causes. What's the science behind that, and explain what those health problems are?
Certainly. So, adrenaline is one of the hormones that the body makes. It's a flight or fight hormone that tells our body that we are under stress, and that in and of itself can cause your heart rate to increase, your blood pressure to increase, cortisol as well, that can be increased in stressful situations, that can impact how the body handles glucose and can lead to weight gain, and all of these things can have negative impacts on the heart. These can dramatically increase the blood pressure, can even lead to someone presenting to the emergency room with anxiety attacks with rapid heart rates, and it can, and also not to forget that even stressful situations lead to unhealthy habits, like people who have stopped smoking may revisit smoking, drinking alcohol, not exercising as much, and all of these things can lead to poor outcomes for cardiovascular health.
Yeah, but thankfully you have some tips for us to help prevent stress from negatively impacting our health. The first one we're going to show you right now. It says we should find out what is causing us stress. So how should we do that, doctor?
Right, so I think, keeping things in perspective and reflecting on your emotions and speaking to someone, finding out what's the cause. Why am I feeling this way? And for some people, they may not find the answer for why they're stressed, right? It's just that everything is just happening so rapidly around them. And one of the things I always tell people and my patients is that you cannot avoid stress, but what you can manage is how you deal with stress. And I think that is what makes really the difference between, really having bad outcomes versus being able to ride the waves.
And the next tip says that we should get help if we need it. Tell us what that means.
Right. So reaching out to someone, as you had indicated at the start of the segment, mental stress is a very relevant area right now. And for some people, that might mean reaching out to a friend, it might mean reaching out to a loved one, might also mean reaching out to a counselor. And if you need that, it's very important to get the help. I know there's a stigma around that and people are very sensitive, but it's best to get the help early before you lead to detrimental impacts. And the other thing too is trying to have an outlet. If there's something that you enjoy, gardening, exercising, walking, trying to actually make time in your calendar for that activity and trying to stick to it as much as you can.
Absolutely. And up next, it says we should try to take a break. How should we be doing that, and why is it so important?
Right. So there are times that you may have to take a mental break from your daily activities. That might mean taking a time out, 5-10 minutes, to really pause, take a breath, and putting things in perspective. I think that's very important. Sometimes that might mean taking a vacation, and that might be a staycation at home, or to go to a family that might be nearby where you can just try to take the edge off, try to take your mind off what's causing your stress. It's very important. So taking a break certainly can be a mini break or a vacation or even a weekend, 2 or 3 days out of the week to try and really take that time that you need.
And doctor, when life gets busy, often people kind of put their physical and mental health to the wayside, but you say that's something you shouldn't do. You should be taking both of those things very seriously.
Absolutely. So actually building time in your calendar that, okay, I'm gonna try to go for a walk, even for 30 minutes, 3 days out of the week, and trying to actually book that in your calendar to really reserve that time.
All right, our last one here. Do we have a last one? Okay, never mind. That was our last tip. Well, doctor, thank you so much for being here. You just gave us so much great information, some things that we are not thinking about that we should be. So thank you so much.
Thank you.
Thank you so much, and enjoy your day. Thanks.
All right, you too.